Welcome to Beyond the Plinth, everything biokinetics, health and wellness orientated. I'm your host, Steve Saunders, and as usual, almost, I've got one half of the mix and one special guest as well. Introducing as usual.
Hi, I'm Wendy Vermaak. I'm the Marketing Director for BASA.
And our special guest discussing our special topic today is...
Hi, I'm Kayla Murphy, and I'm a biokineticist.
Brilliant. So, Wendy, we've got a special population discussion today. Give us a rundown of what we're going to be talking about.
So I guess people don't really know all the scopes of practice that we fit into, and we just thought we'd showcase one of the areas that potential patients could be missing out on, and that is pregnancy and postnatal ladies. And Kayla here has got a special interest and vast experience in that, and we just thought we'd get her take on it.
Brilliant. So it's going to be very interesting because it is one of those, the human species is here because we go through this process. We have babies and we grow the population. But part of that process, it's a traumatic process. In the last couple of years, when I say last couple of years, let's say 80 years, the medical world has made that a safer process that people are developing out of. But now we're starting to look at, well, what happens postnatal? What happens with development? How do we help those ladies through with progress and getting their pre-buds back? Or what? How do we say it? What are the topics? You know, I'm a male. My only experience with this is having my son, and obviously I didn't have him. So I sit on the outside. I've watched the process, and it was an amazing, mind-blowing process to see that women can do this. But what are the effects?
So, can I hop in here?
Absolutely. Go for it, Kayla.
So back in the day, the view was quite different to what it is today. Doctors would put pregnant ladies on bed rest during their pregnancies, and they didn't really advocate for exercise much. So over time and with science and research has proven that exercise is very beneficial during pregnancy, and biokinetics has a huge role to play in that exercise. So we as biokineticists are medically trained professionals, we're clinicians, we have that clinical background, which gives us an advantage as pregnancy can be quite a high risk patient. Well, the pregnant patient can be quite high risk, and they can turn high risk at any point during their pregnancy. So different conditions pop up. They might have
all those niggles, that you hear about.
Yeah, lower back
as men have to
pain.
Deal with. I'm joking. So I've got to ask you a question while you're going down that line. Take you back one step.
Yes.
What were the effects of that prescription of bed rest as a generic description for all pregnant women? What were the effects?
Well, a lot of ladies would get, because they're so sedentary in their pregnancies, they would get gestational diabetes. They would put on a lot of weight during their pregnancy. There would be quite a lot of preterm labors coming about. There would be quite congenital defects in babies. So a lot of it was just bad health. Ladies would have bad health during their pregnancy.
Longer labors, because, labor is like a marathon. Yes. So if you don't train for that, if you're not strong and fit for that, drawn out labors, complicated labors, and then of course the effects on the babies as well.
Yeah, and absolutely.
And babies, it's research has proven that if you have a healthy pregnancy and you instill healthy habits during your pregnancy, it can have lasting effects on your baby, and they have a higher chance of leading a healthier lifestyle.
And the recovery capabilities for the individual, that must be a big effect as well.
Definitely. You have a quicker recovery from birth, especially if you're doing natural, but also with C-section as well. So Definitely leads to a quicker recovery and getting to what you were saying, that pre-pregnancy body, yes. Getting that back.
Yes, because this definitely changes. You can't live the absolutely normal, maybe athletic life you would have had right up to the nth degree, although some people seem to push those limits. But let's bring in those questions in about biokinetics, the the mandate and the philosophy of what biokineticists do, and this special population group, this group of half the population pretty much who are likely to go through this experience. What is the information that's important? What are the factors you're looking at? In fact, I'm going to leave it there. Let's start with the basics. So someone's pregnant. They're going to go through this process of hopefully a successful pregnancy, and they're going to have a new child, and a whole lot's going to happen to their body. How does the biokineticist fit into this process to assist them through?
Yeah, so as a biokineticist, we do quite an extensive history just to make sure that that patient isn't a high-risk patient and that they are able to exercise. So we look at different red flags, and we have quite an in-depth knowledge of the treatment and the exercise prescription for this special population. So whether a lady develops lower back pain or a pubic symphysis or maybe a diastasis recti. So there are many different conditions that can develop during pregnancy. So in layman's terms, if your abdominal muscles separate, this is quite a common condition to experience during pregnancy. We as biokineticists have the ability to modify the exercises for those ladies and adapt them accordingly because we've got that clinical background. So we know what you should be doing and what you shouldn't be doing. And that's how we as biokineticists can guide you through your exercise journey through pregnancy and help you to exercise in a safe and effective way.
Okay. And relating that not only as a clinician, but as a mom, in fact, both of you as moms, you understand this process as well. So intimately. Both of you have that experience both as the patient, the mom, and as the clinician. You understand both sides of that process, so you can understand the experience as well. Kayla,
I just want to say first, I think maybe in this talk we're sounding like, that pregnancy is a disease here. It totally isn't. It's just a condition. It's temporary. Thankfully. And we're coming at it from your healthy population as well as from a treatment perspective, because those niggles do crop up, and that's exactly what Kayla is pointing out. Like, very few women have this seamless, airy-fairy glowing right through the way pregnancy. And a lot of us would like to exercise right through. And now it's a matter of, can you do it safely? Can you do it with the right kind of supervision for the conditions that you have? Is there a way around it? What are the outcomes? And that's really where we come in. So with the healthy population, but then also the complicated part of it. Yeah.
And I think also just to add on to that, if, you are exercising during your pregnancy and you are exercising effectively and in a safe way, you are likely to have a good pregnancy and a healthier pregnancy and less niggles and all of that.
Definitely.
So you're definitely putting yourself in a better position.
So my question back to both of you, through the process of pregnancy, did you follow all the advice? And
I, as a matter of fact, attended sessions with Kayla. So yes, thankfully.
Well done.
Brilliant. So run us through from a mom's perspective that experience that you're talking about, because it's a bit unrelatable for half the population. And the other half of the population, only a certain percentage of them will actually go through this experience. But what is that developing experience? It's a life-changing experience for me as a dad. It totally shifted my world, and being able to be a part of it, but it's not happening to me, was mind-blowing.
I think pregnancy for me on a personal level was an incredible experience. It wasn't an easy experience in any way because there were so many changes that I had to deal with, feeling that morning sickness, trying to balance that and feelings of fatigue and working and stress levels and worrying about your baby and making sure you're exercising enough and all of those things at once. But at the same time, it's the most beautiful experience to see how your body is changing. And coming from, that's it. And being a medical person, I loved everything, to see how my body changed and how this hormone increased and this one decreased and this, so for me it was a life-changing experience, and it actually made me want to be healthier for my babies, and that is what it does to a lot of ladies.
It's a good external motivator.
That's it, yeah.
It's one of the most interesting things that if you look at people who gain weight over a certain period of time, some people gain a couple of kilos a year on year. No one becomes, grotesquely obese in 1 year. But with pregnancy,
I've succeeded a few times.
But with pregnancy, you gain a lot of weight in a very short space of time, and that has a huge impact on your body. For some people, psychologically, it's a major impact. This is where exercise also comes in. It's an empowering thing. You're seeing your body as functional and strong and capable, as opposed to just this lugging incubator of sorts,
Yes.
Yeah, and just making ladies aware that picking up weight during pregnancy is actually a good thing.
Yes.
It's not a bad thing. Obviously, you don't want to pick up too much weight, but in my experience working with so many ladies, I've noticed how it bothers ladies that they're picking up weight and they try not to pick up weight, but we just want to educate them and tell them that it is normal and this is where your weight is going. It's this, your placenta weighs this much, your water retention weighs this much. So it's a beautiful process, and you've just got to embrace it and all the changes that come with it.
So the next question I got for you guys then is, did you prescribe yourself a program of exercise through the process of pregnancy? And what did that look like? And what should it look like? So your own experience, as well as what you would give out. Obviously, it's never going to be absolutely generic. It's going to be personalized. And being Biokineticist, everything's going to be based on the individual. But for you guys, did you follow the program you'd set?
So I needed that external motivation, to be totally honest with you, because
So the psychology there.
Yeah, because I work with patients all day and have to think for them. When it got to me doing this for myself, I didn't want to have to do it. So
That's very important.
Yeah, it was. And I saw the value in two things. A, having a biokineticist doing something specifically centered around where I was at with my pregnancy. And then B, as the external motivator, so I got both sides of that coin. So I loved that, and just not having to think myself. And of course, there's a class environment often as well, and that's also nice and motivating. You're like with your crew.
Yes, and I think that's, for me, that was the same. And being around other ladies who are in the same sort of space as you was quite nice, because then you can chat about common things and problems and concerns. So that's what was quite nice, to exercise with other pregnant ladies. But I would, for myself, always just make sure that I would, if I was quite tired, I would just do a little walk if I could. Just something short, just do something just to, exercise a little bit. And that's always what I say to my ladies, is that even if you're feeling tired, just do a little bit of a stretch. But you should be exercising at least 4 to 5 times a week, about 20 to 30 minutes at a time. And it doesn't have to be hugely intense impact exercise. We don't want that. It must just be moderate, intense exercise, just so you're getting that heart rate up a little bit.
And what sort of guidelines do you give as a moderate intense? You consider that like up at 60% of a maximum heart rate, or is that
no, we stay
difficult to
away from
monitor?
heart rate.
Yeah,
Okay,
yeah.
it's
We
very
don't use
difficult.
heart rate in pregnancy because it's not an accurate measurement.
Not inaccurate, so that throws that one out. So you're on with
But
the
we
heart
use
rate monitor.
RPE. So
RPE. Okay,
yeah.
explain RPE quickly
So-
for those that don't know.
So it's called rate of perceived exertion, and basically there are different levels that we expect you to work at. But the main thing with RPE is just to maintain a conversation, but not be out of breath. And then we know what kind of level you're at, and that's a good level to be at. So you should be able to have a decent conversation with someone and be okay, not out of breath and suffering.
Moderate, I suppose.
Yeah, moderate.
Moderate for that person.
Okay, so if they've never done exercise before, then moderate's not going to be as intense as, say, Wendy's type of exercise.
Oh, thanks.
No, for some, moderate exercise is vacuuming the house, so
I'd consider that intense.
depends
That's why
on how
men
big
don't
the
have
house
babies.
is. Exactly.
Okay, so some of the more challenging experiences women go through. You've mentioned some of the issues that can pop up through the experience. Let's run through a couple of those and particular interventions that you can assist with, or Biokinetics really plays a strong role in supporting those patients with.
So when it comes to pregnancy-specific conditions, I've mentioned just previously that a lot of ladies suffer from lower back pain, sciatic pain, pubic symphysis pain, diastasis recti. And as from a biokineticist point of view, what we really try and focus on in pregnancy is to strengthen the core and the pelvic floor muscles, and to strengthen the whole body, in fact, to withstand the changes that pregnancy brings about, and to better be able to support the body with your growing belly. We work on proprioception exercises to help with your balance. So we strengthen the whole body in order to help you better deal with the little niggles that come with pregnancy if they arise. But in saying that, if you've got a healthy pregnancy, we really look at strengthening those muscles to allow you to have an easier birth, a quicker recovery, and to exercise longer throughout your pregnancy. So we often have ladies who exercise until the day before they give birth. So as biokineticists, we can look at what conditions they have, we can assess them, we can make sure they are getting the most effective exercise for their pregnancy.
Brilliant. So would you have different interventions, basic guideline interventions in this process from term to term?
Are you meaning trimesters?
Yes.
There's different capabilities during different trimesters. So let's go to even pre-pregnancy.
Yeah.
Right. So what about the women who are struggling to fall pregnant? So exercise has a massive impact on fertility. So that's just in assisting them to be better able to conceive, right? So that's even before you getting to the point of your first trimester. Then with a number of women, those who've never exercised before are not likely to start in that initial trimester. It's a sensitive time. They're not used to doing exercises. Most likely their physician is going to say, look, just wait until that 12-week mark, that first trimester. The second trimester is when you're starting to feel really good. You potentially don't have as much nausea, fatigue, and whichever. Now you're feeling quite a lot more capable. So that's actually sometimes the time when people are quite sort of frisk and ready to go, I'd say.
Yeah, that's the golden trimester. We often have ladies happy and they love exercising. They've accepted that they're pregnant now as well. So I think also what some pregnant ladies also don't know is that you shouldn't exercise on your back for longer than a minute towards your end of your second and third trimester, because it can stop the blood flow to the baby. So certain things like that. You shouldn't exercise in a really hot environment. It can cause neural defects in the baby. So you want to manage your hydration, make sure you're exercising in a well-ventilated room. So just giving them some education on those sorts of tips that you might not think about when you're pregnant.
Wow. So lots to consider here. We're not just talking about someone who's carrying a bit of extra and another life within them, but actually a whole lot that could go wrong within that process, within something they're pursuing as a healthy factor, but could turn out to be quite damaging.
Yes, and some ladies who are quite avid athletes can go overboard, and they can do too much during their pregnancy because that's what they're used to, and they think that their body can handle that. However, some ladies may get injured because they're not doing the right thing. So it is Biokinetics has a big role to play in educating ladies about what they should be doing, but then also postpartum, when they can start exercising again, to make sure that they don't hurt themselves, don't injure themselves then as well.
We can also come in from a preventative side of things, because you're often seeing a biokineticist. We would do certain checks with our patients, which they might not be doing for themselves when they go and do regular stuff. So if they are have a bit of a concern, for instance, with their blood pressure, when they come in to see a biokineticist, we would absolutely monitor that a lot more closely instead of them just having to have that checked at the nurse or the doctor's appointment. So sometimes we actually pick up these things sooner rather than later, which is obviously beneficial for the mom and beneficial for the baby.
Okay. So what are some of the mistakes that get made that you see out in the market? When I say that, out in the market, out in the world, but it's the understanding for a woman who's going into that experience, her first point of call and medical support is going to be their gynae. That's going to be, unless they're going a natural route, they'll still have a gynae with the medical intervention and maybe a midwife or something like that. But outside of that, what are the treatment modalities, the preventative activities, the things that they're not likely to see, but pick up reading something odd and decide they're going to try something because someone wrote something somewhere? What are the things you've seen out in the market?
I can't say that I think it's a general thing. I think, to be honest, women are much more cautious. It's suddenly this realization that you are now carrying another life and it's not about you. So I haven't seen too many outlandish things other than, some women being very concerned about weight have now taken up vigorous running. Now, it's just not ideal. And then they read this article about someone who entered the Olympics at 4 months and still competed and won a gold. And that's wonderful for her. But she is a trained, long-standing athlete.
Yes.
And so you can't compare. And I think that, again, it's just that individual aspect is so important. But I actually find in my experience, we're trying to encourage more as opposed to pull back more. Because, I think naturally there's that maternal protective instinct that often does kick in.
So the likelihood of finding that overambitious person who's decided they're going to take up the athletic pathway of an Olympic pursuit of some sort is unusual, but you have seen those articles have an effect. Majority going to be holding back, so it's going to be more a case of probably not engaging enough of the constructive exercise routines and getting the education, because I'm getting an education as we go through this process, not lying on your back for too long. All of those factors are going to be important, which trimester it's going to affect the person and what stage. So these are areas that we need to, I suppose, bring up is what would typically a first trimester, second trimester, last trimester activities look like. And you were mentioning first trimester, very cautious. You've got to be very careful within that area. Second trimester, golden trimester. Final trimester, what's the activity?
Do what you can.
Yeah. Survival mode.
Keep your marriage together.
Yeah. I think, so what Wendy mentioned earlier, first trimester is a very cautious trimester, and we do generally only have ladies starting exercise at that 12-week mark. But in saying that, if they have exercised quite a bit before their pregnancy and they exercise quite a lot, for our runners, for instance, they generally will exercise throughout, even from the beginning stages of pregnancy. But we would normally like to wait for that 12-week mark just to make sure that everything is good. We make sure that they have clearance to exercise from their gynae. This is really important for us. We really like to have that clearance. It doesn't have to be written, but just that verbal clearance from their gynae, just saying, you know what, you're good to go, you can exercise. And that's for pre and postnatal exercise. And then, first trimester, you can kind of really do what you normally do. Unless you're feeling really sick, that can prevent you from being able to do any exercise. I know myself, I had quite bad morning sickness for the first 16 weeks. And I really battled to exercise. I really battled to do anything because you just feel quite sick. And then second trimester, as we say, it's our golden trimester, and that's when everyone's feeling great. They are so happy that they're pregnant, and that's quite a nice, fun trimester. And everyone seems to be quite happy, and we can do quite a lot, and we can get quite a lot of exercise done, and that's a lot of our standing work. A little bit on our back, but making sure that we're not exercising on our back for too long, making sure we turn them over and working quite a bit on the pelvic floor there. And then we get our third trimester, and that is when they become a little bit grumpy. But
I don't know what she means.
The fatigue kind of kicks in third trimester. And I often find that with my ladies is that, often they might cancel last minute because they are just so tired and exhausted.
Again, I don't know what you mean.
and especially in second or third pregnancies or fourth pregnancies, I find that, with my second pregnancy, I battled a lot more than my first pregnancy with energy, with exercise. You're running after a toddler or you've got another little baby, so it really can be quite challenging to get motivated. But third trimester, we kind of do a lot of the same exercises as second trimester. We might just tone it down a bit and make sure that the closer they are to their birth, we might not get them to do as deeper squats. We don't want them to go into labor in class.
No, that's not ideal.
Yeah, I actually opted to go into the pool because I was just feeling so heavy, but I wanted to move. And I just felt like walking up that hill was just not going to cut it. So on my in-betweener sessions, I got into the pool, which was really much more comfortable, for me.
And we actually have started we started hydrotherapy classes now for pregnancy. And they have proven to be really, really great. You just got to make sure the temperature of the pool is not too hot. Make sure that they are hydrating and make sure the acidity level or the pH level of the pool is good. But that's a great and effective way of exercising during pregnancy.
Brilliant. So, Kayla,
yes.
Let's wrap it up. Your elevator pitch, final little bit, advice to the market from your perspective as a biokineticist with experience both personally and professionally with this special population group. Give us your final wrap up.
I would like to just encourage you to exercise during pregnancy. You won't regret it. You'll have a great, great experience, especially with the feeling that comes along with it, feeling healthy, doing, what is best for you and your baby. We haven't touched much on postnatal exercise, but it really, really is great to get back into shape, get your core nice and strong, re-educate those muscles. So I encourage you to live a healthy life for you and your baba. So get in there, get motivated, spring into action, and you can do it.
Brilliant. And Wendy, from your side, how do people get hold of a biokineticist who can deal with these special population groups?
Steve, it is so easy.
Yes, I'm waiting for it.
On the internet, you can go to our website, which is www.biokineticsa.org.za, or you can follow us on any of our social media. We're all over the show at Biokinetics SA.
There we go. So, folks, if you've got any questions, queries, anything you'd like to argue out with us, happy days, drop it in underneath at the messages, and we'll get back to you as soon as we can. To Wendy and Kayla, you guys are rock stars. Thank you very much for coming through and chatting with us today about pregnancy, exercise, biokinetics. Thanks for coming through to chat to us today about everything to do with exercise, biokinetics, and pregnancy. It's been a privilege to chat to you, and I've learned a huge amount.
Thanks for having us.
This podcast was produced by Johan Turon and the team at Soundpatch Studio, presented by yours truly, Steve Saunders. Interested in doing a podcast? Drop us a message on soundpatch@me.com. That's soundpatch@me.com. As always, thanks for listening, and catch you on the next podcast.